Welcome, everybody. Thank you for joining us for part 2 of our monthly webinar series. And today we're going to do our introduction to medical respite. So for our agenda today, we're going to go over our program history, funding overview, program challenges, key opportunities, and future vision, and how best ways to support what we're hoping to accomplish in medical respite, and then we'll have, believe, plenty of time for open discussion and questions. So before we get started, we'll do some introductions. My name is Scott Kim. I'm the program administrator for our Casa de Respiro program. Today with me, I have Randa Mejia. She's our program manager. And a guest speaker, Jennifer Biggs, who is our partner with El Rio Regional Health Center Director. And since myself and Randa are the only two official CCS employees for this program, we asked Jennifer if she could join us today. So thank you for being here. So as we go through, talk about medical respite and what we're hoping to accomplish, I thought this is sort of an interesting thought to ponder. Sir Michael Marmot is a professor of epidemiology and public health at University College London. He says, "It is unreasonable to expect people to change their behavior when the social, cultural, and physical environments around them fully conspire against them." So as we consider what people experiencing homelessness go through and the challenges to them healing and recovering and having a better quality of life, I thought this was a sort of poignant quote. The program history. The conceptualization of our medical respite program started over 8 years ago, back in 2016. And then fast forward to 2022, CCS completed a needs assessment through considerable amounts of research. And it's also around when we started our capital campaign, which was highly successful and raised close to $6 million. We're very fortunate that El Rio has joined us as a partner to provide medical services and other guidance as we developed our programming. We intend to serve individuals experiencing homelessness with either an acute medical condition, such as an illness or injury, or with the exacerbation of a chronic condition. So, for example, somebody who has poorly managed diabetes may need treatment for neuropathy or an amputation. Our team is going to be comprised of kind of two separate groups of people. We'll have 14 respite assistants who will staff our facility 24/7. And then we'll have a team of health navigators who are going to work really intensively with care coordination and case management needs to address social determinant of health needs and other basic needs. We are the only facility of our kind in Southern Arizona. And I take although I've not even been here a year, I take a particular amount of pride in being involved with a company that was willing to lead the way on this sort of mission. In Phoenix, we're similar to another organization called Circle of the City, and they have a couple other facilities that are more medically focused. And as you'll hear more later this morning, we are going to be more focused on the behavioral health needs, the social determinant of health needs. So while we are not funded yet, our intended program funding sources will include the Arizona Healthcare Cost Containment System fee for service, also through access a program that will be implemented in October of this year is the Health and Housing Opportunities, also known as H2O. And this is Arizona's first real attempt to do housing as healthcare as a concept. So the idea is that without without a roof over your head, it's not likely that you're going to be healthy. We are currently exploring contracts and agreements with local hospitals. And special thanks to Elena for leading the charge on that. And we're also looking for philanthropic fundraising, and very pleased to announce that we were, as of yesterday, awarded a $2 million grant over 3 years from the Halley Foundation.
Congratulations.
Thank you. We're very, very, very excited.
Very excited.
I started jumping up and down.
Yeah.
So as for our current challenges, these are things that we're working through, and we expect to come to full resolution, but these are nonetheless the things that are challenging for us. So developing contracts and agreements with hospitals and other stakeholders, so demonstrating the value that our medical respite program will have for not just healthcare organizations, but for the community at large. And this is important to securing diversified and stable funding. So research across the country has shown that medical respite programs are most likely to be sustainable when funding comes through various channels. We expected the Access H2O funding to hit last October in 2023, and learned towards the end of the year that it wasn't going to be implemented until the end of this year. And so that it extended our time horizon for going live. And right now we're anticipating an opening date where we'll accept our first guests likely in May this year. And something that makes this work also challenging is that it requires a very high level of collaboration with our community, our other community stakeholders. So whether it's discharge planning, whether it's accepting referrals, that the level of integration that we have to have with the community is at once a huge opportunity to make a significant impact in the landscape of healthcare in Tucson, but also requires a lot of work. And it's been work that's been really rewarding and exciting to see. We're excited to reap what we've sown. And so I'll turn it over to Randa at this point to talk about our key opportunities and vision.
So Casa de Respiro, our medical respite program, what we want to provide is a safe and clean environment for recuperative care for people experiencing homelessness. And what that means is, again, as Scott said, when someone's leaving the hospital and maybe from an amputation and they regularly would go out to the street and try to continue their own care, most of the time that doesn't happen. And they increase the likeliness of getting a more severe infection, and then it snowballs into a larger issue. So our mission is to offer secure space for individuals to recover from medical situations that may worsen if they return to the streets. So in saying that, our first step is going to be for us to reduce hospitalization, improved access to aftercare, and decreased emergency department presentations and hospital readmissions. So really, if we are taking care of that population, that means that we're helping with their primary care and ongoing follow-up care with physicians, occupational physical therapy, things in that aspect, to make sure that they're not entering the emergency room. The second piece of it is improving housing and security. Improve housing security. So reducing the rate of homelessness and increase access to resources. With our population we are serving, we're seeing that they are an older population that are ready to, you know, to be in a more stable long-term situation. So as Scott said previously, is, you know, we want to improve their overall health, and improving their overall health starts with housing. And we want to help close those gaps in healthcare. So reducing barriers to healthcare and create sustainable option for following illness and injury. So again, it's one of those that we really want to make sure that we are closing that full circle and making sure they're taking their meds, they're doing follow-up appointments, and just really literate in their healthcare needs and how that's going to help them overall, not just for the short time that they're in a hospital stay and then they leave. We want to make sure that we are closing the gap and that they get their needs met. So again, the challenge. So when someone gets into, they go into the hospital, you know, for an illness or injury or chronic condition, they discharged unhoused, back to the street, back to camps, maybe, you know, even just sometimes they're staying in the hospital, you know, and still not able to, because they can't discharge anywhere else. So then when they do finally, there's no follow-up care. That means, you know, no prescription, not filling their prescriptions, because, you know, getting their prescriptions isn't that important to them at this point. It's more, where am I going to stay? I have, you know, maybe just the, you know, I just had an amputation. I'm looking for somewhere to stay and not really worried about, you know, trying to get their prescriptions filled at that point. And then the condition worsens, and then they're back into the ED. And again, this is that cycle that just continues to happen, and we want to try to, you know, put, you know, stop that curveball from happening, that circle. So the change, again, it's what we want to see, that change. We want to see them be able to go into, you know, the hospital, get their care, get their medical needs taken care of, discharged to Casa de Respiro. And while they're in Casa de Respiro, we are helping them, you know, providing that recuperative environment for them to, you know, heal and be comfortable, where they won't have to leave during the day, and, you know, just really just be comfortable. And then we are going to meet their needs by working with El Rio and getting their medical needs taken care of. They will have food, shelter, and case management. And with our case management, as long as they agree that, you know, that they are tired of living on the street, and they are ready to have a more stable living environment, then our health navigators will work with them to transition to stable housing. And then, you know, overall improve quality of life with the skills that they're learning here at Casa de Respiro. So how can you support policy advocacy for the community-wide need by telling the CDR story? Volunteer opportunities, you know, we will have some hospice care that we will also have here at Casa de Respiro, end of life care, and so we will need eventually some volunteers, you know, with helping with that, with their spiritual, clerical, other needs, donations, hygiene items, socks, and underwear. So again, as I go through a lot of the, you know, kind of in a nutshell, that's what Casa de Respiro is. We are working to transition our guests here to a more stable housing. And some of those opportunities that we do have, we are looking at internally, building some internal transitional housing programs within our own organization, as well as working with our partners in the community, such as La Frontera has an interest in working with us also in helping us house our individuals, our guests here. And so really, working with our community and making sure that that our guests are a part of that community and they understand how closely we are going to work with them, and that housing is going to be our end goal for them. And that's very important to us in our grand vision goal for them is to get into housing. I know that that's kind of really the short version of what Casa de Respiro is. And if there are any questions that you have as far as programming and things like that, this would be a good time to ask them.
Thanks, Miranda. I see that Alexis has raised their hand. So
Hi, sorry, I couldn't unmute myself for a second.
it's okay.
So I know that you said that unlike Circle 6, which is more medically focused, you guys are going to focus on behavioral and social changes. So are you looking to, like, I'm wondering what kind of medical conditions people would discharge with. Is it going to be people who are exiting for like inpatient psych, or that maybe wouldn't qualify for skilled nursing because of their behavioral background?
That's
So,
a really good question. We'll be primarily looking at admitting people who have, even if they have comorbid behavioral health conditions, that for the most part that those are stabilized, and that really what they're in need of is a safe and clean environment in which they can heal from their medical conditions, which isn't to say that we won't also be addressing the psychological and emotional needs of the folks that are here. And so our health navigators will be trained behavioral health technicians that will have experience in working with people that have mental health conditions.
So, like, if they're discharging with like IV antibiotics, would you provide that service, or?
Yeah, so there's been a lot of discussion about IV antibiotics, and I don't know, Jennifer, are you here with us this morning?
I am, Scott. Good
Okay,
morning.
thank you.
So at this current time, we will not be accepting anybody with IV antibiotics that require them to get it routinely throughout the day. But we are exploring with some outside home health infusion companies and some other resources to see if we can offer that service in a different way. But at this time, we will not be taking anybody that needs routine IV antibiotics.
Okay.
Thank you for that question. And I think what it helps to do is for us to kind of conceptualize our medical respite program as being at its core a shelter with additional wraparound services. I'll see another
Thank
hand.
you.
Scott, this is Richard. At what stage are the discussions with the various hospitals? Which hospitals are you discussing with, and where are you with them with those discussions?
So we've had our kind of very high level discussions with executive leadership at Tucson Medical Center, Carondelet, Northwest Hospital, and in Banner. And our goal with those discussions was to create some buy-in at the executive level. And so our next steps in those collaborations will be to start working with the leadership that directly oversee the people that are providing services at that level. So the discharge plan, the directors of discharge planning and social work and case management.
Does that include Banner in Phoenix as well? Or
Not Banner Phoenix and not yet. So just the leadership that are over Banner main campus and South Campus.
okay, I was just asking because I used to work at the Phoenix location, BUMCP. So if later on, I know the care coordination director, the services, whenever they go live, I could probably like give you their contact information so that way they know, because they get people flying in from all over the state. So I don't, anyway.
Yeah, absolutely. Let's connect after, and anybody that you can put us in contact with, we'd really appreciate that.
Okay.
Richard again, sorry.
Sure, gotcha.
Can you expound on the volunteer opportunities that Casa de Respiro will offer to members of the community?
I think we're going to try to really approach that as kind of a we're really an open book for volunteerism for this program, just because we've had members of our community approach us with different ideas about how they'd like to contribute. And so we've had people that, for example, have extensive experience working in hospice care. And because we have 2 private rooms that we intend to use for hospice care, that we think that there might be some opportunities for volunteering there. We'll just look to tap into the community and in wherever the passion and the expertise lies, because while we're going to be recruiting and staffing with the best in the business, we know that we're not going to be able to that we need to draw on the experience and the compassion from our entire community. So Richard, short answer to your question is I don't think we have a clear idea on that yet, and so we're just kind of keeping an open mind.
And this is Elena. I think that is such a great question, Richard, because as Scott also mentioned, I believe that once we get started, we'll have a much better idea. But one of the things that I've been thinking about too is that volunteer opportunities will be posted. We'll make sure that these are shared internally and with our board. And there are plenty of opportunities, not only coming in and doing arts and crafts, doing working with, as you know, our guests are coming in with pets. We're going to need some help with that. We're also going to need help with during mealtime, because although we are not preparing all the meals on site, we will need additional people to help us during meal times. So we'll make sure to put something together that will clearly define all the great opportunities. And because we're a 24/7, 7-day-a-week facility, that opens up opportunities for people to volunteer after hours or during the weekend as well. But even people coming in and welcoming our new guests and helping with paperwork, giving them a tour when they first join. I think there's going to be so many wonderful opportunities to making sure that they feel welcomed, that they understand the resources available. Because as you can imagine, especially at the beginning, right? We're just getting started. We're just getting fully staffed. We're going to rely on volunteers now more than ever. So there's so many different opportunities. If any of you are interested, reach out to me directly, to Scott, and we'll be happy to talk to you more about that as well.
Lena, thank you, Scott.
Scott, this is Sharon. Just thank you for this morning's presentation. Both you and Randa did a great job. And I saw there was a question, Amy asked it as well. So with the Halley Foundation, do we think we can apply that grant so that we can open sooner, or will it take a while to get the grant and kind of get that going?
Yeah, thank you for capturing that question. And so, you know, it was certainly is a huge step forward for us to have the Halley grant come through, and it's those monies are going to go towards operations, and so it will give us the ability just to look at posting positions and bringing more staff into the program. And but as with everything, if we want to do it the right way, that'll take some time. And so we do still anticipate a go live date sometime in May. So it was very timely and in line with what we were projecting for this year.
Got it. Thank you. And congratulations. That's just a wonderful thing for the organization. So yeah, great job.
Thanks, Sharon, and definitely kudos to the team, because they did such an amazing job really highlighting the benefits of the program, but really the impact in the community, and being the first one of its kind here in Tucson. We are really setting the tone. We're really creating a model to be followed, and we're very proud of that. And what our model is really, it's very unique to the one that we mentioned earlier in Phoenix, because we are partner with El Rio. El Rio will provide, as Scott mentioned, all the medical care. And what we are really looking at is looking at homelessness from a perspective of it's going to take the community to really work together and address this issue. And to me, that's very exciting. I know that's something that's very exciting to the team as well, because this opens the opportunity for partnerships. And that is something that we have been very intentional in from the beginning. And I'm very happy to share with you that we have now a formal partnership with TMC Hospice. We are providing hospice care to guests that actually need that level of care. We're very unique in that sense. And the other very interesting partnership and very strategic partnership is we have La Frontera and Primavera shelters, because we are looking at a successful discharge when our guests are medically cleared and they can successfully discharge to housing. We want to make sure that our guests do not get discharged back to the street. And so we want to make sure that that transition is seamless, whether it's through Primavera or La Frontera. It really depends on what is the best fit for our client, for our guest. And we are looking at that next step at the time of intake, which is fascinating because we're looking at a wraparound process, wraparound services from day one. What are those services that our guests need? And we are coordinating and planning with our strategic partners to make sure that as soon as El Rio clears that individual clinically, they are transitioning into housing. And of course, mental health, right? Behavioral health, all those services will follow. We will make sure that those services are following our guests when they discharge. So there's that seamless transition. And I think that is something that we find extremely, it's very exciting. and the response from the community has been phenomenal. So this is not just Catholic Community Services trying to address this particular need in the community, but through our partners, we will most definitely make sure that not only are their medical needs being met, but behavioral and ultimately those housing needs are met as well.
Thanks, Elena. I want to get to a couple questions from the chat. So it's Teresa asked, can we support guests who are dialysis patients? And correct me if I'm wrong, Jennifer, I believe that we will be able to. And because our case managers will be working so intensively, or I'm sorry, our health navigators will be working so intensively with our guests, they'll be able to take them to those appointments.
Yes, that is correct.
Okay, very good.
There is another question in the chat. Are we doing the case management or La Frontera or the hospitals? Casa de Respiro, our health navigators, will be doing the case management piece. We would have liaisons that are going out after referral. Sorry, back up. After referral comes from the hospitals, our health navigators will go out and meet with the individuals, ensuring that the criteria is met and they're able to come to Casa de Respiro. And our health navigators will be able to work with them on their ongoing needs, which would be, starting off with their primary care, getting them in contact with El Rio, making sure that that all their appointments and prescriptions and everything that is like that is obtained. And all the follow-up appointments are going to be made, as Scott said, with our health navigators. So again, we will be doing the case management after the referral.
Yeah, and so just to expand on that a little bit too, I think the way that we're thinking our case management will interface with other case managers throughout the community is while our guests are here with us at Casa de Respiro, we take ownership of all the case management and care coordination needs. And part of our discharge planning process will be that as we look to exit or successfully discharge somebody from our facility, then we provide a warm handoff to other case managers. So we had another question in the chat from Amy. What about those who do not have access and arrive to Tucson with nothing and are experiencing health issues? So that's a great question. Actually, came up in our discussions with Carondelet, and specifically the St. Mary's Hospital, that they have folks who are attempting to cross the border and end up jumping the fence and then breaking a leg and trying to do so. And so we've talked about the uninsured and how we do that. So what we hope to do is to build a funding model such that we are able to absorb the cost of providing shelter and care to those individuals, and not having a lack of insurance be the barrier to them having a safe haven. Thank you for the question. I had another question. Will there be security at Casa de Respiro? We're kind of on both sides of the fence with security. The Circle of the City organization up in Phoenix has a uniform security. I think that for the most part, what our decision was to have all staff trained in nonviolent crisis intervention and de-escalation strategies, such that security is not required. Although we do recognize that there may be a need for additional staffing overnight, just to ensure the safety of our staff and our guests. And late into the night, early into the morning.
And because, I'm sorry, Scott, to add to that, because we are on the same campus as Gospel, Gospel does have a uniform security that circles the parameter of the whole property. So not only do they watch over just Gospel, that Center for Opportunity, but the whole property, all of us as a whole in our little community, I guess I would call it.
There's also been an informal agreement to share radio frequencies with Gospel Rescue Mission, El Rio, Department of Economic Security, which also has an office on this campus, to should there be any bigger sort of safety concerns, that we're all able to communicate with each other. So another question in the chat.
Hello, it's Kara.
Oh.
So, will Richard be here the first week in March, or is he taking his vacation? Did you? Mhm. Okay.
No.
Okay. 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 Yep. Yeah.
I'm gonna mute Kara. I think maybe she didn't intend to share.
I know, I'm like, I don't think that was part of the questions.
The group. Okay, got it. So another question in the chat: will you have a virtual interpreting app for languages and deaf people provided? That's a great question, and I think it's something that we need to consider very carefully as we look at the use of our technology, and we intend to have
At least some technology geared towards that. I know for the beginning, just in the policies, the idea is that we would have, we would be able to use our technology to be able to use the, like, you know, whether it's translation or texting, or the different apps that are available for that population, for us to be able, for our healthcare navigators to be able to use those. So we want to make sure that, you know, that we are able to house, you know, anyone and address their needs. So yes, so that is something that we are going to definitely try to work with.
any other thoughts, questions, comments?
And this is Amy. I also want to kind of rephrase my question. The reason I'm asking about this is because communication access is so important. How do they explain their needs or their symptoms if they cannot communicate? You know, if they need medical assistance, how are people communicating with them? How are they learning to cope with their struggles? And getting their community needs, their insurances, all those things. So equal access to communication is really important to know what these clients are in need of and what they're looking for.
Right. I've worked with ADHS before, and for nonverbal clients also. That was a big push, and they had put out some training for us, and then they also had put out for the community other applications that we're able to use. So because our health navigators will have the tablets to work with them. Also, we want to be able to have some technology for our guests also to be able to access and use them if needed. Also, like when there aren't health navigators around, the idea is they will be able to use a tablet, or we can acquire cell phone, some sort of technology for them to be able to express their needs. So we do have that at least piece written in there to where that's how we think we're going to be able to manage those situations. But again, if we have to bring in other translators or any other kind of assistance, we will be looking at trying to make sure that their stay here is fruitful, that they are able to get their needs met.
Absolutely. And just to add a little bit to that too, I mean, we are an agency that is proud to serve the deaf and the deafblind. So who better than CCS to know the particular needs of that very special population? So Amy, thank you so much for bringing that up. We would welcome you and our team from COPD, BCD to come and join us, review our materials. We would love to get your advice, your expertise on this issue. We want to make sure that everything is accessible. I've learned from you and from this group too, that we need to make sure that even our forms, right, are accessible. And so I think this gives us a wonderful opportunity to collaborate and bring this level of expertise to medical respite and Casa de Respiro. The other wonderful thing is that we're partnered with Lango, our interpreting company, right? They're partners of ours, not just for Casa de Respiro, but for all of CCS. So most definitely we will have an interpreter from Lango, and with you and the team at our COPD campus, I believe that we will most definitely be reaching out to you for that guidance and leadership as well.
Great. That sounds really good.
And I'll just add briefly that as a access contracted provider, it's incumbent upon us to provide interpretation services, and as a result, our various managed care organizations such as Arizona Complete Health, Banner, and United also offer interpretation services at no charge. So I think we're well covered in the area of addressing language barriers. Hey, what else do we have this morning? You know, it took me like a good month or two to sort of wrap my head around what we were intending to do and hoping to accomplish through our medical respite program. And so I know it's kind of it can be kind of a complex concept, and we purposely made our presentation short so that we have plenty of time to talk through any questions or ideas that people might have.
So in the chat, there was another question that said, what is the maximum amount of guests that Casa de Respiro can have at one time? How long can guests stay? So we are a 48-bed shelter that is 36 male and 10 female, and then we have the 2 private rooms that we would like to use for hospice care. The stay, that is going to be decided on, how much time they need to recuperate, and the idea is 30 to 45 days would be enough time for them to get into, for us to be able to move them into transitional housing. So again, it's going to depend on what their goals are and how quickly we can get them there.
Good morning. This is Narelle. So I'm working in child welfare and I have a lot of housing challenged clients, and there's no funding out there for housing, and Section 8 has no housing monies right now. So do you guys have a secret housing stash someplace where these folks are going to be able to go in June and July, or something that you've pre-planned with La Frontera? Because I know you said we were going to be working with them as partners to move forward and identify housing. Just because I know our resources are just very limited in our community.
Yeah, and very limited is a nice way of putting it. It's the demand far exceeds the supply, and so it's I think it's part of why we're looking at sort of novel or unique kinds of relationships with other community stakeholders, such as La Frontera, to create straight pathways into housing. Because as you know, I'm sure you are fully aware, it can take many, many, many months to get somebody into a permanent housing, or even a transitional housing situation, right?
Has
Go ahead.
has Gospel maybe set aside a couple of units within the Center of Hope that people could use, or are they keeping their housing, specifically for their population? Because I know in sharing resources in the past, they have helped with some, but too, they, at a point they cut off for community providers and say we're keeping these resources for ourselves, for our client needs.
Yeah, so we're looking to partner with as many organizations as we can, so that we have as many options as we may need. So Gospel Rescue Mission has said that they would they'd look at reserving some spaces for our guests that are in a place of transition, that maybe we've gotten the housing ball rolling, but they've healed and we need the bed here at Medical Respite for somebody else. So they have a place to kind of like, for lack of a better term, they can sort of park there for a bit. We're also working with Old Pueblo Community Services, Primavera, and what's been really exciting about the exploration of these opportunities is that the community recognizes is that this is a potentially game-changing kind of program where it kind of bridges different community resources, and it's worthy of taking a closer look at what we can accomplish if we all pull together.
Scott, this is Sharon again. The partnership for the hospice care, will that be done at Casa de Respiro or the step-down facility?
Yeah, so we are looking at, again, forming partnerships with TMC Hospice, also with Hospice of the Valley, which is a prominent provider of hospice care in the Phoenix area, and they're sort of making their way into Southern Arizona. And what we hope to be is sort of the neutral grounds on which various kinds of healthcare providers can come and provide the care that's needed, and that we can support, whatever the non-medical needs are, to make sure that people are receiving the care that they need.
And so for the hospice, I think the last time I toured, there was maybe a couple of rooms for hospice. So is the thought that the hospice would take place somewhere else and you would just do the couple there, or?
That's something that we're we're considering. And so while each of our two private rooms were designed to have one bed, sounds like it's looking like we could actually fit 2 beds into each room. And we're continuing work on developing a continuum in using all of our CCS assets and properties to best meet the needs of the community the way that we can. And I think it's only become really clear to us in the past 3 to 4 months that hospice care for people experiencing homelessness is significant.
Yeah. Yep. Thank you.
Anything else? Thank you so much for all the great questions and discussion. It's really what we were hoping for this morning.
I want to thank you all because I think this was very informative, and all the questions brought a lot of questions, I think, for the future. And you guys in the team are doing a great job. Thank you.
Thank you for that feedback. This has been a really a great journey of every question bringing more questions for us. So can't thank everybody enough for all the support that we've received as an organization and from the community at large. And this is really something that we believe is going to take a little bit of investment from everybody that is connected to anybody who lives in our community.
Yes, thank you guys all for the questions.
All right, we're at 10:55. So we just want to kind of open it up to any last minute thoughts, questions, observations.
The only thing I would say is if anyone knows of anyone that's interested in working in our medical respite at Casa de Respiro, reach out to Scott and Rhonda. There's going to be several opportunities. Somebody asked if the monies from Hale Foundation will allow us to open sooner. I believe we'll definitely be on track for opening. But we're going to need people, right? And as you know, that's not an easy task. So if you know of anyone, any friends or families that you would like to refer, please reach out to us, and we'll be giving you guys more information about the various opportunities. And I know that HR will be posting those very soon as well. And the same for volunteers. So please talk to your friends and family. We're super excited. Help us share that excitement out there in the community, because we're going to need a lot of that support.
Thanks, Elena. And absolutely. And it's what they say, it takes a village, right? And so our village is certainly going to continue to support our community and to serve the people who are in the most need. And so just want to thank you everybody again for joining us and for taking the time out of your undoubtedly busy Friday morning. And look forward to hearing from you with anything else that you might have for us.
Thank you, everyone. Have a great weekend.
Thank you.
Bye-bye.
Bye-bye.
Bye.